I do orthopedic trauma is my specialty. So beyond the 5 years of training for orthopedic surgery in general, I spent an extra year training in traumatology. And I am the director of orthopedic trauma at Miami Valley Hospital. And I also am heavily involved in running the Orthopedic Trauma Fellowship. So additional trainees, having finished their orthopedic residency training, are now coming here to spend time in trauma training. So I'm heavily involved in education of not only orthopedic surgery residents in training, but also the Orthopedic Trauma Fellow, who's spending an extra year in training in traumatology here. I started that program approximately 10 years ago, and we're on our 11th fellow. So that has been going very well, and we have a number of individuals that we've trained that are now out in various parts of the country practicing orthopedic traumatology on their own. So I spent a lot of time outside of my clinical duties for the education part of it, planning committees, curriculum committees, etc., to help further the education of future surgeons. And once again, that's something I've been doing since I started practice, and I certainly appreciate what my educators way back when did for me, and I feel like I need to pass that along and owe it back to our service. It's always been trauma, right out of fellowship. Fractures are our foundation of orthopedics, and I've always had a passion for the trauma, and I still do. So 22 years later, I'm still pretty active and pretty happy with what I do to help people out. So there are 6 of us here in Dayton that are actually fellowship trained in orthopedic traumatology, and I'm one of those 6. While the bulk of my patients come from trauma call, I do see a number of referrals through the office based on conditions such as non-unions, where the bone is not healed first time around, such as malunions, where the bone has healed improperly, such as bone infections, and for various outside injuries where people may be injured outside of town and then come back for follow-up of their injuries here in Dayton. We try to approach it in obviously a caring and compassionate manner, but we also want to provide expert care. And people are in difficult situations after they've been traumatically injured, not just the patient themselves, but their family, because it's a sudden occurrence and unexpected. So we try to do our best, or I try to do my best, to help them through that situation in the best I can.